extremely well is you can do the elbow just like you would do the knee with the A-frame. You know, it's not long enough with this, but with the A-frame like that, but I wouldn't recommend it. Again, National Registry says that you can splint that appropriately just with a correct sling and swath, because most people are going to have that arm up like this and braced up against them, right? And so then we do the correct sling and swath, and that takes care of the elbow as well, okay? And so a lot of those can be taken care of just with that one sling and swath, and we'll show you that again here in just a few minutes, right? So now what we're going to look at is we're going to look at if you have a radius, which side is the radius on of your lower arm? Which side? Thumb or pinky side? Thumb side. Radial pulse, radius runs along the thumb. Ulna is on the other side. Does it matter to us which one of those is broke? No, it doesn't. And it doesn't matter if it's displaced or if it's a non-displaced fracture or if it's just some sort of ligament tear or sprain or strain or something like that. It doesn't really matter. We're going to splint it the same way. Okay. Now, first thing I want you to notice is we're going to use padded board splints with this. We have a hard side and a padded side. Which side do you think goes to the patient? The padded side goes to the patient. Always the padded side goes to the patient. Now, one of your hard and fast rules is boards first and then body. And you'll see what I mean by that here in just a minute. Okay? So thinking about your hard and fast rules, we're going to think about that we say have a radius fracture or a suspected radial fracture here. So what's the first thing we're going to do? You failed. Scene safe BSI. That was a trick question. So scene safe BSI just to kind of keep us out of trouble, right? Do we need to do the scene safe part for this skill? No, but we're just thinking scene safe BSI. All right, scene safe BSI. Then what are we going to do? We're going to walk in as the EMT and we're going to take manual stabilization or direct our EMT to take manual stabilization. We're going to hold that thing still. And do we want to hold it up like this? I would say no, because then if we slip, what happens? So we want to hold it like this or manually stabilize it, whatever the case may be. So then let's say that I have my EMT assist. You're going to be my EMT assist with your left hand, holding that up there. Then what do I want to do? Hard and fast rules. PMS before and after. So we're going to check a pulse. Are we looking to count it or anything here? Nope, we're just seeing if it's there. And then we're going to have her wiggle her fingers. Wiggle your fingers. Do you feel me touching your hand? Can you squeeze my hand for me? All right, PMS, pulse, movement, sensation, right? That takes care of it. All right, so then we're going to take our padded board and we're going to slide this underneath here. Now, before I do this, you can see that that's there. What I'm going to do before I do that, and this, I'm just showing you the way it's going to sit. Some people will take and do like this, and that's perfectly acceptable, okay? National Registry, the research that I've done, says that this is more appropriate for a position of function, okay? Because this way, if you put something too big in the hand, you could bring that up like that too much, and then you're moving these muscles and cause more pain or more damage. Does that make sense to everybody? Okay. So before I actually apply that, though, I'm going to have my cravats, triangular bandages or whatever. So let me see this, please. And I'm going to do boards first. All right? So I'm just going to have them laying on my board like that. Now, a couple things I want you to understand. You cannot tie over a joint. You can't tie over a joint. The wrist is a joint, okay? You can also not tie over the injury itself, all right? So you'll see what I mean here in just a minute. So I've got them sitting on my board like that. That's the way you're going to start this splint out. You've got manual traction, you've done your PMS, and then I'm going to slide this underneath just like that, and I have those laying. And my EMT assist is going to hold that in place at the same time holding manual stabilization. Then I'm going to take and make sure that I'm not on her wrist, and I'm going to cross over my boards like this, and then I'm going around the arm. Okay? And we want to try and do our best to tie on the board itself, not on the patient. If we happen to have to tie on the patient, what do we want to do? We want to pad the knot.
That was rather tight.
Is that tight?
Yeah.
Is it still too tight?
No, it was at one point.
Well, good.
Just woke me up a little.
Builds character.
Suck it up, Buttercup.
Say first pineapple carry.
Pineapple juice.
Oh.
Sorry, I didn't mean to.
What did you say?
I
She
said the
your
safe word's pineapple, and Adam
That's
dropped
funny,
his
I'm
drink,
allergic
and
to
everybody's
that.
passing
Are you
out.
really?
Yeah. That's
Like,
not a
Everyone's
safe word for
safe
me.
word.
They're
That's
drinking.
really funny.
Yeah, I'm allergic to that.
Oh, well.
It's like,
Pineapple juice.
eh.
Mr. Booty Hole Man.
I'm glad someone
Please,
laughed.
somebody tell me they made that
Yes.
video.
Yes.
Seems relevant to the safe word being pineapple.
It does, yes. You'll have to look it up.
I'll stop now. I worked last night. I'm still in ER trashy mode.
Huh?
Nothing, I'm just proving a point on live camera.
Oh, that you're not holding manual stabilization?
Oh, no, I was.
What am I doing? What
Carrie, you look
Keep
good
going, I'll
on
tell you later.
camera.
I
You can
promise.
watch the video.
Yeah.
You're all going to jail.
Fine.
No, keep going,
All right,
I'll tell you in a minute.
So
I
she's
promise.
got manual stabilization. Now I've tied those two there, right? All right. Now remember, I've got to do the joints or the bones above and below. So I also need to secure her hand here. So what I'm going to do is I'm going to leave her thumb free, and I'm going to go around this way, making sure that I don't tie on the wrist. And I'm not really looking at getting that real super secure. I just need to make sure that I actually tie it. Still want to know what y'all are making fun of me for.
No, we're not making fun of you, I just proved a point. But I don't need, it's not about this.
Okay.
It's totally unrelated.
All right.
It's
So do you
totally
see how I
unrelated.
have that tied? Right? All right. So now I have to do the sling and the swath. Okay. So my EMT is still holding manual stabilization. Now remember what we do. We take the corner. We tie an overhand knot. We're going to have your EMT bring this in like this. Yep, that's probably going to hurt. Sorry, ma'am.
This is so familiar as many times I've broken my arm.
You've broken a lot of things.
Uh-huh, yeah.
Arm,
Back.
right?
back, heart.
Heart. I think it's the other way around.
I'm sure you're not innocent. And hopefully you'll have better cravats than this on your truck and or your skill station.
Do they look that dirty when they're new?
Yep.
No.
No.
Yeah,
They're very
not
stiff
white.
almost when they're new.
They have street cred. Look at them. They're all
Yeah.
These
That's
are
legit right there.
these are worn. Many a EMT been taught with these things.
All right. Now, what am I going to verbalize back here? Or actually do it?
Pad the.
Add the knot. I'm going to tie it on her sweatshirt, so that'll kind of take care of that. Do a surgeon's knot and a half hitch. And I'm going to readjust to make sure that I'm completely secured there. Then, my swap.
Carrie, you're gonna fall asleep after he swaddles you all up like that.
Oh, that's a
I'm
big
so
baby.
She's
excited.
like rubbing her eyes like a baby.
Well,
So
I just
cute.
got up.
She's
Like,
so
I haven't even been
sleepy.
awake like an hour.
Oh.
Do you have to go to work?
Mm-hmm.
You do?
Mm-hmm.
You're not staying?
I'm staying until 7:15.
Slacker. Alright, so now what do I need to do?
PMS.
PMS. So, pulse. Can you wiggle your fingers? Which hand am I touching? Which finger am I touching? Alright. And so, that is done. Now, that also takes care of the wrist as well. That would be a wrist splint as well. Okay? So, literally, between these two things, the sling and swath and the padded board here, we have taken care of everything on the upper extremity. Everything that you may pull from your card or have to do in the field for your upper extremity.
Hey Freddie, would you take like jewelry off of that arm before you did? Like
Pro-
you
yeah,
guys do
pro- in
that?
practice, yes. So I was just doing it for the skill
No, is
part
that
of it,
something
but
like
yes.
they would like?
Yeah, because of
require-
the swelling, you would definitely want that to be off.
Would they
so-
like? Is that something they would? Is that something they deem you for like in the scenario?
You won't have a patient with jewelry
Oh,
on
okay.
it. Not that I've ever seen.
But that is a good point.
That is a
Yeah,
very
And I
it's
good
a
know
very
we
good
always
Thank
take
you for
it
bringing
off,
that up.
but I
Yeah.
didn't know if it was something that like they're
Because
gonna
Yes.
this was my skill when I took my
Yes.
test.
I have had to cut
No.
jewelry off.
I have
at the
had to,
hospital
yep.
After EMS is done with the patient, they've been evaluated in the ER, and then you have them in a unit or something, you're going, holy crap, I mean, there's not just injuries, but you know, just medical where they have edema and things like that.
Right.
And
So
that
yeah,
cut
good,
jewelry
very
off.
good point. Thank you for bringing that up.
Very
But yes, you would definitely want to take that off for the swelling. But any questions about anything on the upper extremity?
And the wrist should be above the elbow. I don't think National Registry cares.
They don't
It's my
specifically.
pet peeve,
Okay,
because it's gonna make the hand swell.
good point. Okay, so that I learned that as well. So
The
that's
wrist above the elbow?
the wrist. So you mean it needs to be up a little further like this?
Yeah,
Okay.
you're about good, but I see people walking all around.
Down like this,
around
yeah,
this,
sure.
like-
And what I will say is that when you do, one of my pet peeves as far as this goes is when this is like this, that's not doing anything for your patient at all. When your sling is down like this and not covering where it needs to. You know, you see people that bring their sling and it'll be way down like that, and even if I don't have a padded board, my hand's gonna be going down like that. That's not doing anything for your patient whatsoever. You need to make sure that this is good and spread out to where it's completely holding that, supporting that entire arm.
I've seen that too.
Yes,
In a
ma'am.
lot of different settings.
Yes, ma'am. So, yes, ma'am.
What would you do for a collarbone?
So this would be the collarbone also.
Okay.
Just the sling and the swath, not the padded board. So, yep, the collarbone, or the clavicle is what they call that.
Mm.
Yep. So you wouldn't have the padded board, you would just have the sling and the swath.
Okay.
And that's a very common fracture,
Mhm.
is the collarbone. Very common. Good question. What else? Everybody's going to get a chance to practice these tonight also. Okay. Sound good to everybody?
Yes, sir.
All right, so we're going to release her out of this.
That feels pretty supportive, doesn't it, Karen?
Sorry. I'll wake up in a minute.
Wait till I wake up, then ask me a question.
You want some gum? I've gum.
No, I have some in my pocket.
For
I'm trying.
National Registry,
We had 2
is the
stimmies
knot,
yesterday.
the way you tie the knot, is that specific?
It is not specific. What they do not like to see is you tie it to where they have to cut it. Because if they have to cut it, what does that do to the tension? It releases that tension real hard like that. So a lot of people will do the bunny ears, but I have just got into the habit of doing that half hitch, taking a bite through the loop and just pulling a half hitch, which Dreama pointed out they do that in the hospital also for restraints. In one of my other classes, they said we do that with horses also. It's just you take a bite, go a half
That's
hitch.
random.
What's that?
That's random.
Oh yeah, I mean it was. She trains horses. She was like, we do that with horses to tie them up, and I'm like,
I didn't know that.
all right.
Huh.
I didn't either. So,
Horse
but
figures out they can pull on that.
I do want to point out something here. The reason we do boards first here is because if you just take it and do like this and wrap it around, right? And let's say you don't get it tight enough. When you leave the room, when you get done with your splint and you leave the room, National Registry is going to go and see if they can pull that out. Okay? The psychomotor is. However, if you take and you wrap around this board first and you pull it tight, because I can pull as tight as I want to around that board, right? I can pull as tight as I want to around that board without hurting my patient. So if I get it real good and tight around the board before I go around the patient, it's not going to slide out. It's not going to come out. Does that make sense?
You know, Freddie, I didn't even know that. Thank you for bringing that to
Yes,
my
ma'am.
attention.
Absolutely. Absolutely. So, what questions? Any other questions?
This may be a dumb question.
No such thing.
So these boards I see they're obviously different sizes. Can you just cut them if you need like a different
I would
size?
not cut
So,
them.
the,
no.
so
just
like
a
if it's
piece
a
of board and a
little
in a
arm, you
package.
just like
Yep.
it's here and like you have this little flap
Correct.
hanging out. Okay.
Yep. And then you've got the medium-sized ones, which are going to be, and honestly, very
I guess you
rarely
can't cut those. can
will
They're
you
like-
use these tall
Wood or
ones.
plastic?
These right here.
That's
You
what's
Okay.
might use these on somebody like Hayden or somebody like that. If you've got to put somebody like me on the
Wait,
backboard, you might use
what
one.
would you use that for?
What this or this one?
My leg.
One, oh, okay. I thought we were still talking about arms.
Well, I'm just using them as you said, different sizes.
Yeah.
So I'm just
I was
saying, very rarely would you use this one. This is going to be the one you use the most for legs, and that one's going to be the one you use both
even
for
like
arms.
even like for kids.
Yes, ma'am.
Okay, so you just
Yep.
whatever's
Because
left
what you
over.
can do,
Okay.
what you can do, is instead of going this way more, you can hang it off the elbow more that way,
Okay.
and then you can work the sling around that, or even grab the
Gotcha.
end of the sling like that.
Okay.
Yes, ma'am. And then, again, during the night, I'll go ahead and get out a Sam splint and show you what we talked about, that Sam splint, and how much I hate those, but they're useful for a lot of different purposes. But, you know, I'm not a big fan of the Sam splint because I don't feel like they put enough support on for a proper splint.
They don't.
So, but they're really good because you can cut the Sam splint.
Yeah, we cut them in the trauma base sometimes, but we put them on, and I'm like, I'm not even sure what that's doing.
Yeah,
it just looks like we
right.
did something.
And then in your book, if you go in and look at your book at some of the splinting, they have the entire leg or the entire extremity wrapped, and that doesn't allow any room for swelling or anything like that. I just personally don't like that type of splint.
I've made like no-nos out of them.
Right.
For like grown-ups.
Yeah. And we used to restrain patients sandwiched between two backboards. That's how we used to restrain patients way back in the day. Y'all remember that?
Nope.
Yep.
Holy, y'all
Remember the
rolled
scoop
hard.
stretcher? What was
Oh
the
yeah.
scoop?
What's that?
Usually you use the scoop for the top.
Yeah, but still.
So
I
it's
mean,
like a little coffin.
right. Yeah. I mean, I've seen it both ways. I've
I've
seen it both ways. So yeah, every bit.
Well then.
All right.
All right.
So let's talk about the lower extremity now. We're gonna work for a few minutes on the dreaded knee A-frame. The dreaded knee A-frame. All right. So, Carrie, if you will. So we're gonna say Carrie has an injury to whatever. There's a chair there.
For now, she's a head
Cervical spine injury.
Oh, I was like, what's tickling my face?
We have a cervical spine injury now, and all right. So which knee would you like to have injured? I guess the right side since I'm close.
No,
The left side.
I got stuff in that pocket.
Okay. So we're gonna do the left side. All right. So let's say that Carrie's left knee is injured, and I don't know whether or not this is a dislocation or fracture. I really don't care. It's just an injury to the knee, and my goal here, if you look at her knee that's like this, my goal is to prevent it from doing this. Is to be able to straighten it out. Okay. Now, sometimes you're not going to be able to do that absolutely 100% without her, you know, so where she can't go like this. I can get it pretty close to where she would have to put some force to it to get it to straighten out. But if you've got an injury there, you're not going to have a lot of strength and integrity, so you're not going to be able to straighten that out really either. And then if we get some time, this is not something I've ever seen at National Registry, but I had somebody in one of my BMI classes last year ask me, well, what if the patient has an injury to the knee and it's flat, and you want to prevent it from coming up? And so I taught myself, because I've never seen anything done like that, I've taught myself how to do that as well. And so if we get some time, I'll be glad to show you how to do that. It's just the opposite of what we're being able to do now. All right. So what I will tell you that you need here is 4, maybe 5, and depending on the side of your patient, maybe 6 or 7 cravats. Okay. There's not a set number here. The minimum you're going to need is 4 cravats. 4 cravats. Okay. That's the minimum. Because you're going to have one below the knee, above the knee, and then on the boards either side. Okay. All right, so you take a minute to look over your equipment. You make sure that you have your correct size boards. And so for this patient, these are probably going to work, these medium-sized boards, okay? So I've got those, and I've got new cravats over here if I need them. I went and got them out of my own personal stash because I didn't know how bad these were going to be. All right, so I'm going to make sure that I have my cravats. 1, 2, 3, 4, 5, 6. I got good. No, not necessarily. All right, so what's the first thing you're going to do? BSI, scene safe. And you're literally, people hold their hands up like this, BSI, scene safe. And so you're good. And then you're going to take manual stabilization. Either you do it or have your EMT do it. But if you do it, now you've got to turn it over to your EMT. So now your EMT is holding manual stabilization. And you may even do like this to keep your patient from moving their leg. Okay? Now, in this particular case, your EMT assist is actually going to be of really good benefit to you. Because before I even pick up the boards, okay, this is important. You're going to take 2 cravats, you're going to go underneath your patient's leg, and you're going to lay those on top. So either your EMT assist is going to hold that there, and then at the top of the knee, your EMT assist is going to probably hold that there. Now, you're going to have those sitting there just like that before you even touch a board.